Well, hello there, my friend. Let me be the first to thank you for your support and for simply being present in this space. 2020 has undoubtedly been a year of transformation, coupled with so many healthcare challenges, and together we all have done a remarkable job at facing and implementing strategies to ensure adequate access to medically necessary healthcare services and treatments for those in need. I am especially proud of our frontline healthcare providers who have managed to weather such a fierce storm and done it with such grace. The kind of grace that leaves one's heart filled with so much joy and pride. The kind that also lights a fire under my feet and dares to get me up each and every morning, ready to advocate for medically necessary healthcare services for those in need. I do this, my friend, because I have this audacious desire to see the number of improper healthcare denials drastically reduced. And this desire, my friend, exists because as a healthcare professional myself, I know all too well that improper denials not only inhibits access to medically necessary healthcare services and treatment for many consumers, including the very vulnerable and marginalized population, most of who rely 100% on our public healthcare system, but also because improper denials cause unnecessary burdens and delays in accessing care, all of which can be very detrimental to a human life. The late Nelson Mandela, who remains one of my heroes and mentors, once said, "Do not look the other way. Do not hesitate. Recognize that the world is hungry for action, not words. Act with courage and vision." From a young age, I loved the idea of advocacy. I found it an effortless act for me to fall heavy in burden when another faced unjust situations. I also found it very easy to want to advocate on their behalf. Some may say I found this desire from my father, who was an attorney and so passionate for justice. Others may say it was ingrained in me long before I was born. Either way, the idea of equality and justice always appealed to me, and it only grew bigger and louder as I grew older. In 2017, I found myself advocating for medically necessary healthcare services for millions of Californians. It was not a path that I chose for myself, but when faced with the gravity of the situation, I knew that turning the other side was simply not an option. That if ever there was a time to rise up and defend the lives of thousands, that was the time. And so I went to work, and with the help of some great attorneys and our California regulators, we were able to secure adequate access for all those who were impacted by countless numbers of intentional and improper denial of healthcare services. The issue of improper healthcare denial, my friend, is pervasive and challenging. It's challenging because our healthcare delivery system, quite honestly, is very complex. So many times, improper healthcare denials are not intentionally done. But at the same time, that doesn't make it a non-issue, especially when one's life is totally dependent on the decision we make to either approve or deny care. There is just no justifiable way to explain the existence of improper denials to a mother or a father sleeping at the hospital and hoping their child will be granted the services needed for him or her to live, or for a cancer patient or anyone for that matter in need of healthcare services. And this is the very reason our advocacy firm exists. Not to punish the system, but to challenge it just a little bit further enough to save lives and further enough to bring forth equality in the delivery of healthcare. I will end by quoting my hero once again, the late Nelson Mandela. What counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we lead. Thank you so very much, my friend, for your support, and wishing you and your family a Merry Christmas and a Happy New Year. Love you, Christine. Ciao.